Hello and welcome again to another episode of One Starfish, where our mission is to help change the world one person or one starfish at a time. As always, make sure to rate, review, subscribe, share. This is how we get the word out about what we do. And thank you for all your doing all of that in the last 4 years. Really appreciate that. I'm excited for our guest today. Mariano and I just met. He has a health startup using AI. So we'll get into more of that and what that exactly means. Started about 6 years ago, I guess now. Also ran a lot of other companies before that where he's had numerous exits. So sure we'll pick his brain on some of that stuff for some of you guys. Welcome to the show.
Thank you, Angela. It's great to be here. Thank you for having me.
Great to have you. Well, let's go into your present company because I think that's interesting. Tell us a little bit more about what you actually do using AI for like health.
Yeah, but basically what we're trying to do is we gather data from certain populations. It's normally populations that belong to a health plan paid by an employer. And as we gather data, we know them better. And we try to identify among those people who are the ones more likely to have trouble in the next few months. And as you know, the earlier you identify trouble in healthcare, the cheaper it is and the less painful it is for the person. So that's what we normally do. And we manage to reduce, it's difficult to measure pain, but we managed to reduce expenses by about the rate of increasing expenses by about half. So you would assume that we reduce pain in about the same percentage, but there's no good measure of pain.
Right. Wow, though, that's amazing. So what do you find is, I don't know what the right word is. What are some things that it's kind of like you're underwriting for healthcare? Is that almost like that, but using AI? So see what tendencies people like. Is that kind of what you're doing?
Yeah, I think the healthcare has changed a lot in the last 20 years. So we come with a healthcare system that was devised in the 1940s, 1950s, mainly to care for infectious disease, which was the big enemy at the time. And about 1 in 2 people were dying of an infection at that time. It's not true today, but we keep on organizing the system exactly the same. So give you a very familiar example. Your doctor waits for you, right? So it's counting on you to find out that you actually have something wrong. And that's very easy with an infection because you have temperature, you have pain, you have very clear signs that you have to go to the doctor. It's not that clear with diabetes or blood pressure, for example. You can live with blood pressure for many years without having a single symptom. And you can be mismanaging your diabetes for a long time before you actually get symptoms. So normally what happens is with that paradigm, we are picking people very late. And people are making mistakes before we do that. Just to give you an example on diabetes, about $2 out of $3 we spend in diabetes. And sorry, I'm measuring this in dollars, but it's not the right way. You should be measuring pain, but pain is proportional to dollars, and dollars are easy to measure.
That's right.
So but $2 out of $3 that we spend in diabetes, so around 2 out of 2/3 of the pain that a person actually gets from diabetes is not a medical problem. It's something that it was not identified on time, and the person actually went with it and ends up in an emergency room or develops something that like a retinopathy or diabetes foot or something that is related to diabetes, but it could have been avoided. Still, the number one killer in this world is heart attacks, and those are 95% preventable. So exactly when did we go so wrong that something that is preventable is killing us more than anything else in the world? So our answer to that, or there may be other answers, but our answer to that is we need to change the way we monitor people. We need to monitor them more continuously. And in order to do that, and this is not something that we have not tried in the past, but it was very, very difficult to do this in the past without a lot of data that we can get from wearables and from other sources, and AI that allows you to process a huge amount of data. Otherwise, just to give you a number, about 40% of all the data in the world is related to healthcare. So if you have to crunch into that, by a human, it would be impossible. But if you can crunch into that with AI, Nevertheless, you have to be careful with, I want to be very clear, we're not using AI without any humans in the process. I think that AI is not yet ready to do that. So, but what we do is we identify people that are more likely to have trouble, and then we send them to nurses, our own nurses, or to doctors that actually do the treating. And every once in a while we make a mistake, normally on the overly zealous thing. So we send someone to the doctor that shouldn't have gone. But in most cases, we actually send people to the doctor that, unless we had told them to go, they would have gone, 6, 7, 8 months later, and probably with a much serious condition.
So what do you find is the biggest problem with making this happen? Do you feel like pharmaceutical companies are stopping some of this?
No. To be honest with you, no. Most pharmaceutical companies are actually supportive of this, because they things like GLP-1s or things like that are more and more on the prevention side. So for them, it's actually good. We actually do get a lot of companies that are interested in understanding if the patients are taking their drugs or not. So statins, for example, is something that, in theory, you should probably take for the rest of your life. Most patients would need to take them for the rest of their life. In practice, people take them for about 3-4 months and they stop, and mostly because there are no symptoms of high cholesterol. And so they figure out that, I'm good enough. I can manage without it. So for drug companies, I think it's generally good. I think there are other incentives, though. The incentives that normal brokers for health plans have, it's a percentage of whatever you spend in healthcare. So obviously they want you to spend more. Or the revenues of hospitals, have to do with the amount of money you spend on a procedure. So yeah, so sick people are good for them. And then I don't want to paint this as an evil empire that is around us. I don't think it was like that at all. Most doctors want to do the right thing, but the incentives eventually catch into them in very tricky stuff. So if you give a doctor, for example, and this is very common in emergency rooms, if you give a doctor only 10 or 15 minutes per patient, and you measure them in time per patient, you're not forcing them to prescribe more studies, but you are forcing them to prescribe more studies, because they only have 10 minutes and they want to be responsible. They don't want Angela came here and I want to make sure that she has nothing, but I don't have an hour to actually go through all the questions I should have with them. So it's maybe I just send her for a scan or something. So I'm pretty sure that they do that. So again, he's not trying to do anything wrong, but the incentive is making him do something that you don't need and it's more expensive.
And do you see that this is going to be, because right now you're in which countries with this?
I'm in Brazil with this.
Okay. Is this something that you see going into North America or staying in, South America?
There are companies that are doing this in North America as well. You have Collective Health, for example, which is it's been there for around 10 years, so twice as much as we have. And they have been doing it mostly, I believe, in the West Coast, but they're expanding. They're a large company now. So there are a few others that are doing. Kaiser Permanente is trying to do that in the US as well. So no, we're not the only ones, but I think this has to definitely go global at one point. Everyone understands that unless we tackle prevention, we won't be able to pay for healthcare. So at this point, the number is exactly the same in the US, Europe, and in Brazil. The cost of healthcare is increasing 2.5 times faster than inflation. And in the case of Brazil and the US, where medical expenses are paid mostly by employers, this is the number one cost in their P&L. So you can imagine a CFO of a large company, how does it feel when his second largest cost line is increasing 2.5 times faster than his prices? It's going to become unsustainable. It's becoming unsustainable. So you see, plans pushing more cost into the patient. You see plans being more difficult to approve stuff that was easy before. So we haven't all seen the stories. But I think it's a correlation of, we're not taking well care of prevention, therefore we're paying a lot more than we have. Let me give you the numbers here, because I think they're impressive. But 85% of total expenditure is chronic disease. So if you believe, as I do, and the WHO, and so I'm not making this up, everyone knows that, if you believe that about 2/3 of that, or maybe 50% of that, it's a function of, as I told you in diabetes, and not a function of we don't know how to treat this, but we are not in the right moment at the right time to treat this, then it means that around 40% of the total expense of healthcare, which is 10 trillions per year in the world, is waste. And we can reduce that, but we need to change the whole way that you actually buy and the way that they consume healthcare for that.
What got you into this? What made you decide to start this in Brazil in 2020?
Brazil it's the easiest choice in Latin America. I live between Uruguay and Brazil, and I've been living between the two countries for a long time, so I knew Brazil really well. Brazil is about 2/3 of the total expense in private healthcare in Latin America, just the sheer size of it, and it's a country that has more capital available for startups. So it's kind of an easy choice to start it. I could have started in the US, but it was just too far away and too foreign for me. There are not that many countries though that our model would work because of the way regulation works. So in Brazil and in the US, if you're an employer and you pay healthcare for your people, then you can negotiate with insurer rates. And those rates will depend on, of course, your ability to negotiate, but mostly on how much money you spend. So if you care better for the people, you would spend less money than you would spend less in insurance. This is not the same in every other country. So countries like, let me give you Argentina, which is a neighbor of Brazil, you still have employers paying for healthcare, but you cannot negotiate the price with the insurer because that's regulatory not possible. So if you save money, you won't be able to appropriate part of those savings. In Europe, technically our solution would work, but healthcare is mostly paid by the governments. I mean, depending on the country, by the central government, like in the UK, or by municipal governments or provincial governments, like in Spain. And those are much more difficult to work with. So it really depends on each of the countries. But in the US and in Brazil, this works. So that's part two of reasons. Why we started on pandemics, just serendipity. We were raising money to do this since November 21. We closed the round in March 2022, and the pandemic just got us. So we just started there.
So before this, what were some of the other things that you have done?
So before this, I worked for a long time in corporate. I worked for Lilly, for Pfizer in New York, for McKinsey in Spain. And eventually I moved to Brazil to work for Pfizer and stay there for a few years, but then moved to Warburg Pincus with the idea of it was going to be an entrepreneur by acquisition. We were trying to buy a company in Brazil and run it and then sell it. And it ended up, we couldn't buy the company in Brazil, but Warburg bought Bausch Lomb globally, which was a very large deal, something like 4.8 billion originally, with 3 billion in leverage at that time. That was very cheap. And so I eventually joined the team in Bausch Lomb. I run Latin America with them. We eventually sold the company for 9 billion, about 3-4 years later. From there, I founded a company that was taking advantage that at the time biotech was changing the world in both the US and in Europe, but it was not reaching Latin America. And the main reason was biotech, they're normally smaller companies than big pharma, and they focus on the countries that they can make a reasonable commercial operation without having to overstretch, and they were not reaching Latin America. So our logic was, let's build a platform that can be a home for biotech products, and we will have the most interesting research in the world, not for free, but almost for free, without spending any capital. And that's what we did. I've raised money from Advent and Essex Woodlands, two very large funds. We bought a company in Colombia, then we bought a company in Brazil, then we bought a couple more companies around the region. We expanded that to 10 countries. And then we started getting biotech products. At that time, it was very easy because no one was doing that. And we got about 55 licenses from companies that today are very big, like Gilead or Celgene. At that time, they were not that big. And we reached something like 350 million revenue, and we IPO'd the company for $1 billion. It was a nice story. And after that, I did the same a second time with a company called Moksha 8, and with the help of another fund, a California fund named Montreux Partners. And we did the same, and we eventually sold the company for 250 million to Asino, a Swiss company. So also a very nice deal on a different scale, but very nice.
Awesome. That's a lot. I don't know if everyone followed all of that, but you've run a couple companies and exited. And, have you always been an entrepreneur type then? I know you mentioned you work in corporate, but you went into entrepreneurship. Was that something your family raised you in? And, how did that go over? What were some of the challenges you've overcome over the last, years and through?
I don't know. That's, I never went to school thinking I was going to be an entrepreneur. I'm not one that plans very much ahead. I just, try to follow whatever opportunities you get. I think that what got me into entrepreneurship at the beginning was I was finding corporate a little bit too stuffy, too tight, and too difficult to move. I was at Pfizer it's a great company, but it's very, very large. So in order to move something in a company that large, you normally have to align a lot of people, and that's not something I'm very good at. And so I think I had very good ideas, and it was very painful for me to actually move the whole machinery to make them work. And I'm not making a value consideration here. There are people that are much better than me than doing that, but I prefer somewhere that I could think about things and execute them, and think entrepreneurship gave me that. And I think Warburg gave me the opportunity. I was not looking for it. They just offered.
So the second part of my question there is, what are some of the challenges you've overcome? And what would be some suggestions that you'd give to aspiring entrepreneurs to overcome challenges they might face?
I think the most difficult thing in entrepreneurship is temperament, right? So you're gonna go through trying to build something that in many cases no one has before, or many few people have before. There's no clear solution on how to do that. There's no book you can read and understand that, and you're gonna make tons of mistakes, and you always are doing that, within the confines of very, very limited resources. So if you make mistakes, you get a huge chunk of your cash goes away, and you have to continue to do that without understanding that that you're going to have cash forever. I remember when I was at Pfizer, I never ever in my life read a cash flow statement. Of course they were there, and of course the finance people were doing that, but in essence that we were operating the company, cash was infinite. And adapting to that, and to the stress of I might blow this up every single month. I think it's probably something that is very, very difficult to do. And the other thing I personally find very difficult is you're building stuff, and you make a mistake on what you're building all the time, and you have to change direction. Sometimes letting go. So the first version of the software that we made, we spent about $1 million or something dollars. It was a lot of money for us, and we have to throw it all away. It was incorrect, and you have to live with those decisions. And it's very difficult when you are vested into one idea that just throw it away and do another one, and that happens all the time. So I think that's very difficult as well. If I have to give an idea of how to deal with that, I think it is you have to build endurance to do that, and some people can and some people cannot. I think that being an entrepreneur, it is great for some people, it's horrible for some others, and I know that because now it's in a new fashion that people want to be an entrepreneur and things like that. But in many cases, people probably love to be called entrepreneurs. I'm not sure that they actually like to be an entrepreneur, right? So it's a lot more, it's a lot tougher. You don't get the prestige you get in large companies. You don't get the security that you get in large companies. And if you actually are rational, your expected value is lower. Now, of course, because we've seen Elon Musk and people like that, we believe that expected value is huge, but it's only, a handful. Most people actually lose money in entrepreneurship. So your expected value of going to work for a large corporation is probably higher than being an entrepreneur. So you have to be a little bit crazy. You have to believe that you're going to be the exception. So if you're going to go down that path, you better do it with your eyes open. So you're not taking the most rational path. It's very exciting. It's very rewarding. It's great. And I think, for the ones that are cut to that, it's an amazing career. But you have to have your eyes open that, there are several downsides to it.
Awesome. Very good advice. Several downsides, but definitely worth it. In wrapping up, I always have 3 final questions, and then anything that we didn't touch on that you think would be really impactful for our listeners. And guys, any of this information, I want to check out, what Mariano's doing and all that kind of stuff. It will be in the show notes. So make sure to check that out. First and final question is, if someone's looking for their purpose, what's one sentence you would say that could help them find it?
Well, I'm not sure that that this is the right the answer that most people will like, but I will follow my skills and not my passion. And I know that people see the other way around, but I would think very hard on what I'm good at, and because if you start doing things that you're good at, passion will appear. If you follow passion and you're not good at something, passion will not take you very far. So I will take a hard look at what am I good at doing.
Good, I like it. Second question, what's a favorite quote and why?
It's probably Warren Buffett, well, because I love him, but I think that I'm not sure I can quote it exactly, but he says something like, predicting rain doesn't count, building arcs does. And I actually have that printed in one of my bags somewhere, because I think it's exactly like that, right? So building things, doing stuff, that what changes the world. Predicting or talking about stuff may or may not, but in many cases it doesn't.
Do the work, basically. Yeah. Third and final question, what's one word or sentence you want on your gravestone?
I think that what I would like is something that tells about, I made a difference in someone, at least one person in the world. I think that at the end of the day, that's my definition of success, and I think it should be everyone's definition of success. That if someone is better off because you were in this earth. Hopefully, a lot of people are better off, but one is enough.
I like that. Okay, you run into someone in a coffee shop and they listen to it, and it's intrigued by everything. Definitely, I'm intrigued by all the AI stuff with health. Is pretty cool. And they went through that and entrepreneurship and all the stuff we went through. What's something we didn't touch on that you think would be really impactful to leave our listeners with?
No, I think we touch on a fair amount of things, but I'm always happy to chat with people. So if you go to my LinkedIn, you will find even my cell phone number, and you can get there. There's plenty of information on the LinkedIn about me and books and things that you can understand more about me as well. But happy to chat with everyone.
Very cool. Like I said, links in the show notes. Reach out. You heard the guy. He said, call, reach out.
Yeah, absolutely.
So, I love that. Let's go out there. Let's share this. Let's go out there. Let's change the world. One person or one starfish at a time. If we can change one life at a time together, we can help change the world. Thanks for being on.
Thank you. Thank you so much.